Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Hello, thank you all for coming today and spending your lunchtime with me, especially after a long 3-day weekend. Again, my name is Piali Dattaray. I am an otolaryngologist, head and neck surgeon. My office is located across the street. I work with Jason Van Tassel, and we provide the ENT care here for Washington Township Medical Foundation. Today we're going to be talking about sinusitis. We're going to define what sinusitis is, its causes, determine when you should see a doctor about sinusitis, and then discuss the current medical and surgical management for sinusitis. We'll also talk about the ways that you can prevent the recurrence and onset of sinus infections. So, sinusitis impacts a great number of Americans. They say that approximately 37 million people each year have come to the physician and been given a diagnosis of sinusitis. Chronic sinusitis in itself is more prevalent than heart disease and asthma together at any given time, meaning there's a lot of people that are suffering with chronic sinus infections every day. The symptoms of sinus infections can affect people physically. It can cause them to miss out on work or not be fully engaged in their work, and it can cause an emotional impact. Chronic sinusitis specifically leads to approximately 20 million office visits to a primary care physician or a specialist physician's office in any given year. So what are the sinuses? The sinuses are these air-filled spaces behind the bones of your face. They're the neighbors, in a certain way, of your eyes and your brain. They're there for many reasons, one of which is that they are lined with a layer called the mucosa. The mucosa is comprised of these special cells with these tiny little hairs called cilia. The mucosa create mucus. The mucus is there to protect you. It binds the bacteria, pollutants, the viruses in the environment, and the cilia of these cells wipe them out. So it collects the grime from the outside environment and it slowly pushes it out with the hair of these cells. It's pushed out of the natural openings of the sinuses called the ostia. You have a number of sinuses. You have the frontal sinuses that are depicted here in green. You have the maxillary sinuses that are depicted here in blue. Those are your cheek sinuses. And most people are aware of their frontal or maxillary sinuses. But you also have the sinuses, the ethmoid sinuses. They reside between and behind your eyes. And even farther behind your eyes are the sphenoid sinuses. And those can cause deep headaches and pain behind your eye. Anything that obstructs the flow of the ostia or the openings of the sinuses can cause a blockage and a congestion of mucus inside any given sinus. Experts agree, including myself, that healthy sinuses are key to a good quality of life and that unhealthy sinuses can lead to some unwanted complications. So what is sinusitis? Itis is just a simple suffix for anything that is inflamed, okay? So this is a general term describing the inflammation of the nose or the paranasal, meaning the sinuses around the nose. It is a condition that's often preceded by a viral infection or cold, an allergy attack, or exposure to a lot of environmental pollutants, okay? The common symptoms of sinusitis include nasal congestion, facial pain or discomfort, nasal discharge, as in postnasal drip, or in nasal discharge coming from the front of your nose. It can also be accompanied with headache, tooth pain, and fatigue. okay? The time that you should consider whether or not you have a sinus infection is if you're having the symptoms of a cold that's lingering a little long. The average cold should stay anywhere from a week to 10 days, but if you're still having nasal symptoms or any of these symptoms I have mentioned for greater than 10 days, it's time to consider, am I having a sinus infection? Another time to consider whether or not you're having a sinus infection is if you have a cold and then all the symptoms improve except for your nose symptoms. And then you might also consider maybe my nose is still inflamed and I have a residual sinus infection. In addition to cold or allergy or environmental pollutants aggravating the mucosa of the nose and sinuses, you can also have mechanical or structural causes that can cause sinusitis. One such cause of mechanical disruption is ciliary dysfunction. So I just mentioned that the lining of the nose is composed of cells called the mucosa. The mucosal cells have these tiny little hairs called cilia, and if those cilia don't work properly, you can have mucus that just remains stagnant and is not being properly circulated out. Conditions that can lead to that include cystic fibrosis. So children with sinus infection, we consider things like ciliary dysfunction and cystic fibrosis more than we do necessarily in adults. Other more common reasons for structural causes for sinusitis include a deviated nasal septum. And so deviated nasal septum can be something you're born with, just from the simple development of your nose in utero in your mother's womb as you're becoming from 2 cells to a person. Or you can have a deviated nasal septum after being punched in the nose or after a fall or a car accident. And so this is an X-ray. Well, it's really a CT scan of a patient. And in a CT scan, which is just a type of radiographic study which we do to investigate the sinuses, the white is bone, the gray is soft tissue, and the black is air. So in this is a picture of your skull, and the white is the bone. Here the gray is brain. Here this gray is your eye, and this is the soft tissue of your cheek. And you can see here that this is where the jaw and what we call the maxilla, where your teeth are. Okay? And these are your maxillary sinuses. In this person, the sinuses are fairly open and they're filled with air, versus having an infection where it would be gray and filled with fluid. But you can see here, the point of this picture is to show you how this structure in the middle, the septum, can be deviated, and in this picture it's deviated to the right, so it could cause potentially an obstruction of the maxillary sinus as it tries to drain into the nose. So in those cases, with people with obvious structural abnormalities that can block a sinus, medicines may not be as effective, and you may have to use medicines in concert with surgery in order to resolve these underlying structural abnormalities. Another structural cause for disturbing the outflow of the sinuses includes polyps. So this is a very graphic picture. This is an ENT doctor with what's called a nasal speculum. The nasal speculum is placed in the opening of the nose, and then you see these pink swellings. They're like water balloons of the mucosa lining the nose, and this is characteristic of a polyp. Polyps are just secondary to the inflammation that's due usually from allergies. And so you can be having sinus disease because your nose is filled with polyps and blocking the natural openings of your sinuses. Other causes for sinusitis are immunocompromised. People who have HIV or have recently been undergoing chemotherapy, they're just at risk of other infections in general, not to exclude sinus infections. Okay? We also define and separate sinusitis depending on whether or not it's acute or chronic. Acute sinusitis is a situation in which you are experiencing symptoms for less than 4 weeks, okay? People who have acute sinusitis, it's more likely that they're bacterial in nature. Subacute is when you lay in the middle and you're experiencing symptoms between 4 and 12 weeks. Chronic sinusitis is when you're experiencing symptoms for approximately 12 weeks or more. It's less likely that it's less likely that there's going to be bacteria or fungal infection acutely present in a chronic sinusitis. You can have a chronically inflamed state even far past the initial trigger of the viral infection, the bacterial infection, or the fungal infection. So the symptoms might be milder, but by virtue of it being there longer, you can have caused some structural damage to the lining of your nose and the opening of your sinuses. So that leads us to the question, how do I know I have sinusitis? When should I see a doctor about sinus infections? What should I do? And so anytime a patient has a viral infection or cold-like symptoms lasting longer than 10 to 14 days, that's a good time to consider seeing a physician for evaluation of sinusitis, okay? Also, it's important to consider if all of your other cold symptoms have resolved and you're still remaining with some nagging nasal symptoms, to consider going to see a physician and being seen to evaluate for structural abnormalities or polyps or ongoing sinusitis. It's important before this 10-day period, if you're experiencing facial swelling, eye swelling or pain, decreased mobility of the eye, or neck stiffness, that you see a doctor sooner, because sinusitis can lead to infections in the eye, meningitis, or even abscesses or collections of pus in the face that you need to treat earlier than that 10 to 14-day window of time. As physicians, specifically ear, nose, and throat physicians, we do have criteria for sinusitis. So we see a lot of patients who come in and say, I have a headache right here, I know it's sinus disease, give me an antibiotic, but unfortunately it's not that simple. And we have to consider other symptoms. And we have strict criteria for defining sinus disease. So the major criteria include whether or not you have nasal congestion or fullness, facial pressure or pain, thick mucus and nasal obstruction, or a change in your taste and smell. Okay, so as you can see, our bias is tilted towards the nasal symptoms rather than the vague symptoms of headache or dental pain. Those fulfill the minor criteria. So if you have symptoms such as headache, fatigue, bad breath, fever, tooth pain, cough, or even ear pressures, those are not as specific for sinusitis, and we consider all of your symptoms together. Usually you need at least two major criteria on its own to diagnose sinusitis, or you need two minor criteria with one major criteria to diagnose sinusitis. I don't know if that was clear. So you need two major criteria, or you need two minor criteria with one major criteria. So just because certain symptoms are more specific for the sinuses and certain symptoms can be a myriad of other things, okay? So I'm an otolaryngologist, and not everyone has been to an otolaryngologist. Most of the time you go with your cough, cold, and flu to your primary care doctor. So I was just gonna take this time to explain what an otolaryngologist is. So an otolaryngologist is just a fancy word for somebody who specializes in the ear, nose, and throat. We complete anywhere from 5 to 7 years of training after medical school, and we're trained in the surgical and medical management of all the diseases from the clavicles and up, namely dealing with the ears, nose, and the throat. We're the physicians that wear the funky head mirror that we use to reflect light and look in the back of your nose and throat, okay? And when you come to us regarding sinus disease, we'll conduct a thorough examination of your ears, nose, and throat, spending time specifically on the nasal examination, where we note if you have polyps or a deviated nasal septum, or what the kind of mucus you're having inside of your nose. We also will palpate your face and sinuses to note for swelling. We will also do a thorough eye examination, make sure that that's working properly and it's not being complicated in its function by your underlying sinus disease. And we also conduct what is called a fiber optic nasal endoscopy if necessary. And so there's a picture of this here. So what that involves is we use a special camera that's linked to a TV screen usually, and we use this flexible camera that magnifies the view of the inside of your nose. We spray you as a patient with a local numbing nasal spray, and we gently place this device in your nose so that we can better look and see the opening of your sinuses, how the postnasal drip is looking in the back of your throat, how your throat is looking and your vocal cords are looking. If you have polyps, your deviated nasal septum, it allows us a thorough examination from your nose, the back of your throat, and your voice box. It's something that we do routinely on both adults and children. It's done awake and allows us for the most thorough evaluation of your nose and sinuses. So, after being seen by a physician, there are occasions in which they will order other tests or imaging. Tests and imaging are not routinely ordered or necessary for the diagnosis of chronic sinusitis or acute sinusitis. If we do tests, we might do a test of the CT of the sinuses. We generally start taking CTs if you have a complicated sinusitis, complicated meaning you have collections of pus or meningitis, or your eye is not functioning properly or something we're more concerned about. We also start getting CTs of the sinuses if we're planning to do surgery. So that's how we can evaluate your anatomy and safely pursue a surgery for clearing out your sinuses. We may order an MRI, which is a different type of image, and it's more specific for helping us delineate in the case that we're concerned that there might be a tumor in your sinuses. So this will help delineate the borders of a possible tumor and see if it's extending into your brain or invading nerves and vessels. But we do not necessarily routinely order any imaging for acute sinusitis, and we may not need any imaging at all to diagnose you with sinusitis. A lot of primary care physicians or ER physicians or different physicians may order x-rays, but us as ear, nose, and throat specialists, we do not use x-rays or find x-rays particularly helpful in the diagnosis or treatment of sinus disease. So if anyone offers you an x-ray, you're either better off not having anything done or asking if a CT scan could be done instead. Okay. Additional tests that we can consider for people who with chronic sinusitis include allergy testing. Many people suffer from allergies. The way that you might have a hint to whether or not you suffer from allergies are if you have itchy eyes, runny nose, this itchy sensation in the back of your throat that you're constantly wanting to itch with your tongue, these really vague symptoms of itch. That might be your indication that you have allergies. Also, if you're having sneezing or scratchy skin or watery eyes in response to either pollens or your neighbor's cat or your wife's perfume, this can also indicate that you might have allergies. And people with allergies that are not effectively controlled with medicines and sprays, we might need to consider doing some allergy testing. Allergy testing can help you determine what exactly you're allergic to, whether it be something in the environment or a food that you're eating. That way you can avoid these things. It's particularly tough if you're allergic to 20 different things to avoid them all, but it is a way to help you treat your allergies avoidance. Also, after allergy testing and after the trial of medications, we can consider what's called immunotherapy or allergy desensitization, where we start to inject you with small amounts and increasing amounts of the specific thing that you're allergic to. That way your body gets tolerant to those specific things you were once intolerant to and stops mounting such an allergic response. So that's something we can consider for people with chronic sinusitis and known allergies, okay? Especially in children, we may add the extra test of the sweat chloride testing, which is good for determining whether or not you have cystic fibrosis. This is a diagnosis that's more common in children. We may also order HIV or other immune function testing for people with risk factors in their history that might indicate that they might be immunocompromised, and this leading to their diagnosis of sinusitis. Finally, we may need to obtain nasal cultures for patients who look like they have purulent or pus-filled sinuses. However, it's not improving with antibiotics, and these cultures can help guide our antibiotic management. Again, we don't necessarily do nasal cultures for people with 1 or 2 acute sinusitis infections a year. We tend to do this for people who are on their 4th course of antibiotics and it's not getting better. Okay? So, what are your treatment options? Sinus symptoms can make you miserable, impact your quality of life, but in order for you to get relief, it's important that you make the right treatment decision after proper evaluation by your doctor. So the first step, and I tell my patients that come to my clinic, whether it's regards to allergy or whether it's regards to sinus disease, both of these problems are chronic problems. There unfortunately is not one single quick fix for either of these problems. They are more managed than they are cured necessarily, and they take a concert of multiple different therapies in order to effectively control the symptoms for a given patient. And we always start with medical therapy first. And the things that we recommend are inhaling steam or using a humidifier. This is mostly for symptomatic relief. It helps people feel like their passages are open, that they can breathe better, that their congestion is being relieved. So it's something that I encourage people to do if it makes them feel better, because whatever you can do to feel better, that doesn't have any side effects. You know, inhaled steam is one of those things that we recommend. The other thing that I avidly recommend to all of my patients is washing your nose with saline nasal flushes. It's one of the better things that you can do. And it may not be adequate enough to just get one of those little bottles of ocean spray and go squirt, squirt, one in each nose. I think key is using volume. They have these special sino-nasal rinse kits, and you put a packet of salt into the bottle, you shake up the bottle with the water, and you flush your nose with half the bottle on each side, and this functions to clear out the mucus that sits in your sinuses. It also moisturizes your nose so that your mucosa feels moist and doesn't need to compensate and lubricate with production of more mucus. It washes out the bacteria, the viruses, the pollutants, and the allergens that sit in the mucus. And it also helps you feel relief because the mucus isn't there causing that pressure and that pain. I also advise people to wash their nose, especially if I prescribe them sprays, because it's akin to having acne. You need to wash your face before you put on the creams on the acne, right? So that's the same principle that we follow in regards to putting medicine in the nose. We also advise you to wash your nose. It's also important to take advantage of using over-the-counter decongestants, okay? Especially oral decongestants. And I know a lot of people have colds and they're afraid to take medicines, but if you're having an onset of a viral infection and it's about your 5th, 7th day and you're feeling really congested, don't be a hero. Take a decongestant, take it as directed, be safe, try to clear yourself out, see if it gets better, because having that mucus just sit there can lead to bacterial sinusitis and residual sinusitis after that cold. And also, we recommend fever reducers and over-the-counter pain medicines, because you might come begging your doctor for antibiotics, but that's not going to do as great of a job with fixing the pain and the fever as a Tylenol will. So you're going to need to use both. So don't be shy about using safely, as directed, fever reducers and pain reducers for your headache, facial pain, and the fever. I also recommend antihistamines to patients with the sinus symptoms and the other allergy symptoms, like the itchy nose, the itchy eyes, runny eyes, itchy skin, itchy throat. Antihistamines can really help with that sensation of itch. And so here's a little aside on nasal decongestant sprays. Nasal decongestant sprays are one of those things we're very tentative about fully recommending. We recommend with a caveat, with an asterisk. And so examples of these nasal sprays include Afrin, Neosynephrine, Duramist, and Sinarest. And these function to vasoconstrict the vessels in your nose. When you're inflamed, when your nose is clogged and plugged, it's because the blood vessels have vasodilated to release all of the inflammatory chemicals and mediators and to release the mucus. Okay, and so these sprays, people love these sprays because they work instantaneously, they vasoconstrict the nose, you automatically feel open and drier. And there is nothing that works as quickly or as well as these. However, that being said, your body builds a tolerance to these, and you eventually need more and more spray, more and more often. And then your body develops this rebound dilation. So you develop the cycle of your body even being more congested and more dilated, and you needing to spray more and more often. And this cycle and this dependence starts to happen. And so this condition where your nose is increasingly dilated and congested in relation to your use of nasal decongestant spray, this condition is called rhinitis medicamentosa. It's a condition that's completely created out of overuse of nasal decongestant spray. So it is something that's safe to use. It is something that can give you instantaneous relief. But that being said, it is something that you should use very sparingly and use less than 72 hours continuously in order to prevent this rhinitis medicamentosa. And if this is a problem that you have where you find yourself needing nasal spray every day, that is also another condition you can come and see that your nose and throat doctor about and that we can help you with. But ultimately you have to quit the sprays, okay? That leads us to other prescription medical therapies. One of the first things that we will recommend for someone with sinusitis, in addition to washing your nose with salt water, is to use a topical nasal steroid spray. And topical nasal steroid sprays are great. They work locally to decrease and reconfigure the levels of inflammation of the mucosa of your nose. Unlike the nasal decongestant sprays, though, they do not work quickly. They're not going to work after your first spray. This works with daily, continuous use to restructure the lining of your nose. It's like having a rash on your skin. If you just put that hydrocortisone the one day, it's not going to go away after that first dose of hydrocortisone. The same thing with the inside of your nose. Okay? So a lot of people are unhappy. They've tried the Afrin and it's fantastic. They come to their doctor and they're prescribed this medicine that doesn't seem as fantastic, but it is something that takes daily and repetitive use to restructure that level of inflammation inside of your nose. Another thing that we recommend are antibiotics. We usually give amoxicillin first as a first-line antibiotic to anyone with acute sinusitis. And we usually give approximately a 2, sometimes 3-week trial of antibiotics. This is only for people that look like they have a bacterial infection, and it's not only by the color of your mucus that we can determine that. We determine with your fever, the way you look, and the thickness of your mucus, many different factors, but antibiotics is one of the things that we do treat sinusitis with. For oral steroids is a medical treatment that we provide to people who are suffering from chronic sinusitis. It's hardly ever that we give steroids for acute sinusitis. We tend to give this to people who are in an inflamed state but don't appear to have an active bacterial or fungal infection necessarily. And so we are very careful about which patients we choose to give steroids to, because steroids can thin the bones, cause problems with wound healing, it can cause irritability, insomnia, it can cause your blood sugars to be less manageable. So people with conditions such as diabetes or osteoporosis or severe depression or anxiety, we aren't as open with giving steroids necessarily if it's going to make your other health problems worse, okay? And then also for patients with chronic sinusitis, as I mentioned before, we may recommend allergy testing and desensitization in order to get at the root of your inflammatory problem. And all of these therapies, whether they're prescription or non-prescription, they function to decrease the mucosal inflammation, fight the infection, or both in order to open up the natural openings of the sinus. Okay, so Sinus surgery is the next step for someone who's tried over-the-counter medications, prescription medications, and is still suffering. Sinus surgery is something that we usually do for patients with chronic sinusitis. There are very few cases in which we do surgery for people with acute sinusitis, but that being said, it's usually people with acute sinusitis with complications like abscesses or pus pockets in their brain, or other things that most people do not experience, okay? So again, sinus surgery is most commonly employed for people that have not found significant relief with maximal medical management. It has evolved a great deal in the last 30 years, and it continues to become less invasive. Before, we as head and neck surgeons would make huge cuts on the face and over the skull, and use chisels and hammers and cut out the openings of the sinus and dissect the soft tissues off of the face and head in order to get to your sinuses and clear that out. We don't do that anymore. All of that is done, all of the sinus surgery is done through the nose in a minimally invasive way, in an outpatient setting, in an elective manner. There's no more cuts near the eye or on the cheek or over the top of your head. We don't do that anymore. And so it's been due to increase in technology, better imaging, and innovation in the realm of surgery that we're able to offer these new techniques. The goals of sinus surgery are all the same. They are to clear the blocked sinuses. They're there to restore the normal function and preserve the normal anatomy as much as possible of the sinuses. This is what differs from before. Before, they didn't care about the anatomy and restoring it to functioning normally. They just wanted to, they had a hammer, they saw a nail, and they just wanted to, pound. And that's not how we approach it anymore. And we try as best as possible to preserve the mucosal tissue, so that way, once the sinusitis is resolved, it will continue to function normally and won't necessarily reoccur. Okay, so the most common technique that we employ is what's called functional endoscopic sinus surgery. In this surgery, patients are usually under general anesthesia in an outpatient setting, meaning you'll come in, you'll undergo general anesthesia, we'll do your surgery, and you will go home the same day. We use specialized instruments to open up the natural sinus openings. Not only do we use instruments, but special instruments that actually open up the sinuses, but we are guided by what's called an endoscope. An endoscope is a special scope that magnifies at the end of it, and it's attached to a camera. And with that camera, we're able to view the inside of your nose on a separate television screen. So it magnifies the inside of your nose to the size of a television screen. And with this endoscope, our special instruments, and our knowledge of your anatomy, we're able to look in the nose, find the sinuses, and open it up in a natural way. This can also be enhanced with something called image guidance. Image guidance, if any of you have sinus surgery, your physician might order a special CT scan for image guidance prior to sinus surgery. Image guidance involves, I guess the best way to put it is that with a CT scan or an MRI of your brain and sinuses, we make a GPS. So we have a special picture that helps us use an instrument and guides us to where we are specifically in your cranium. So it's a special device that we use that creates an individual GPS for our sinus surgery. I guess that's the best way to put it. And I have a video. It's a little dizzying, and so I wanted to put that out there. It's not of myself doing the surgery. This is one from the textbooks. And, ooh, sorry. Okay. So, and it's important to note what we're looking at. So this is, the reason it's circular is because this is the endoscopic view. So you have to imagine that this is what the endoscope is seeing and projecting on the screen that the surgeon is watching. This is of the left side of the nose. No, this is, oh, I'm wrong. This is of, yes, it is. This is the nasal septum. So this is the nasal septum, and this is the lateral nasal wall. And so this is the left side of the nose. I was right. And I'm going to click this on. So as you can see, that's a special instrument there, that's the suction. It's pulling down part of the lateral nasal wall called the uncinate. This is a special backbiting forceps that's used to take down the uncinate process. That's one of the features of the side wall of the nose. So we take out this uncinate process because it is kind of the screen door in front of the major door, which is the maxillary antrum of this left side. We use a special device called the microdebrider that will both cut and suction and help surgically open the antrum on this left side of the nose. So this is all done through the nose. There's no cuts on the outside of the face. Everything's done with special fine instruments, and that's what we do in functional endoscopic sinus surgery. The major risks of any surgery, I tell this to everybody, any surgery is a risk of anesthesia. Any surgery you have, there's a risk of bleeding, infection, pain, numbness, scar. When it comes to sinus surgery, there's the additional risk that we might cause some additional nasal obstruction because you're going to produce mucus and inflammation after surgery. There are small risks to invading the wall that holds in your eye or your brain, both of which we are able to repair. They're very small, very, very small. But most of the time, it is very well tolerated surgery. People go home the same day. They're glad that they have it, and they can now focus on feeling better and preventing their next experience of a sinus infection. Okay? Now, the new innovation in sinus disease is something called the balloon sinuplasty. And so the balloon sinuplasty is also a procedure employed by ear, nose, and throat specialists. It involves the use of a small, flexible balloon catheter. And I think people have increasingly become aware of balloon catheters as with heart stenting or even limb vessel stenting, where they put a guide wire and then they place a special balloon. The balloon opens up the obstruction and it is gradually and gently inflated to stretch the natural opening of the sinuses. It doesn't involve any cutting or chomping or biting of the mucosal tissue in the way that functional endoscopic sinus surgery does. It also has additional option of it being done while you're awake. So you can undergo general anesthesia with the balloon sinuplasty, or you can have it done under local anesthesia with you awake and willing in the clinic. Okay? There is minimal bleeding, and many patients have been able to return to work and normal activities within a day. Okay, so this is my picture kindly provided to me by a clearant. They're the ones who are making this balloon technology. And so this is a diagram, a 3D diagram of your skull and sinuses. So this shows the introduction of the wire through the nose. And so the wire is being introduced into the nose, and there's special lights with these balloons so that we're able to know that we're in the correct sinus by the special lights at the end of the wires and the end of the balloons. And we also use our endoscopes to guide us to put it in the right place. We're not shooting blind. So this is an example of the wire going up into the left frontal sinus. Left frontal sinus, you see, is filled with the pus, the yellow pus. We gently inflate the balloon to stretch out the natural ostia, and it allows this pus to nicely flow out. We're also able to use this guide wire and irrigate inside of the sinus, which is something we also do in functional endoscopic sinus surgery. But as you can see, it just takes the wire, the endoscope, and our know-how in your sinuses rather than multiple other instruments, chomping, chewing, biting, and eradicating the mucosal tissue in order to open up your sinuses. So that's the diagram of the balloon sinuplasty. And so it's been proven safe. It's safe to be safely done both under general anesthesia and under local anesthesia. It's minimally invasive. Both the functional endoscopic sinus surgery and this balloon surgery are minimally invasive, this being slightly more so as we don't do any microdebriding or excising of the soft tissue. There is reduced bleeding inherently because we're just stretching with a balloon rather than removing tissue. The recovery time for both are pretty quick. Most people go back to work after functional endoscopic sinus surgery in a week, but there has been documentation that people after balloon can go back to work the next day. And they can be used together. So using the balloon for some sinuses and then using the microdebrider and the functional endoscopic sinus surgery procedure for other sinuses, they can be worked together. The balloon is better for people who don't have an underlying structural problem. If you have a nose full of polyps, sticking a balloon and inflating a balloon isn't going to help you. You're going to need someone to remove those polyps that are blocking the way. Or if you have a septum that's deviated or large turbinates, those things need to be managed with a surgical procedure outside of the balloon. But it is an option that is available to you. And so your surgical treatment options are best advised after a thorough evaluation and a discussion with your physician. And so that's what I would recommend. Finally, I can't overstress how valuable I think prevention is for everybody. You know, a lot of our medical problems we can curb or minimize with just being mindful and careful about our life choices. Number one is with regards to smoking cigarettes or cigars or anything, you know. So one of the ways that you can prevent constant aggravation to your nose and sinuses is to stop smoking, or advise your loved ones that who are still smoking around you to stop smoking, because there's just hundreds of pollutants and things that your nose and sinuses can be irritated with regards to cigarette smoke or cigar smoke or marijuana smoke or anything that's smoking, okay? And it's also important to avoid your triggers for allergy. If you are sneezing around Fluffy, your cat, every day for the last 10 years, and I know you love Fluffy, your cat, but one of the key ways is to keep Fluffy, your cat, out of your house or out of your bedroom and save yourself. You know, none of the medicines in the world can really undo the cat that's sleeping with you and making you sneeze. So it's important to be mindful of what your triggers are and try to avoid those as best as you can. Also, I advise nearly everyone to use saline nasal rinses, not because I make any money from NeilMed. You can make the rinses yourself with water and pickling salt or whatnot. It just makes good, prudent sense to wash out your nose just the way that you brush your teeth or you wash your hands from the pollutants, the bacteria, and the viruses in the environment. And it really doesn't take much to wash out your nose, and it helps decrease the number of viral infections that you get each year. It can help prolong your episode to the next sinus infection if you're someone who is experiencing sinus infections. And it's something that is very safe, easy, has minimal side effects, and it just takes the time and the interest to do. Also, I can't overemphasize the need in every way to employ a healthy and nutritious diet into your daily life, because this boosts your immune system. It can help you heal from your viral colds in an effective way and quickly, so that you don't get these secondary sinus infections. And also, consider using a decongestant when you have a cold or virus. You really don't gain much from letting yourself be miserable and holding all of that mucus in one place. All of that stagnant mucus can just lead to sinus infection. So consider using that if it's safe to do so, considering your other health problems and your other medications. And so in summary, sinusitis may give you some of the same symptoms as an average cold or allergy. They're just prolonged, or they don't seem to be getting better. Consider seeing a doctor if nasal congestion, facial pain, thick mucus, or alteration in smell doesn't improve by 10 days or seems to get doubly worse in that time. Medical management is always our first-line therapy. This will generally include both over-the-counter and prescription medications. Surgical management is something that we employ for people who with either complicated sinusitis or people who still suffer after maximal medical management. There are many minimally invasive mechanisms available for sinus surgery that can be done on an outpatient basis or even in the office. Balloon sinuplasty is a new, safe, and minimally invasive procedure for the treatment of chronic rhinosinusitis. And then communication with your physician can help direct the best management plan for you specifically. And so that will end my talk. I'm Piali Dattaray. I'm located across the street. I have some business cards if you want to contact me or if you have any questions. Thank you again for taking the time out to learn more about sinus disease. And I have to also disclose that some of the images regarding the balloon sinuplasty were provided by Acclarent. They're the makers of the balloon sinuplasty technology. And I'm open to taking any questions that you have.
So is it okay if you already have sinusitis that you use an neti pot?
Absolutely, yeah. If you have sinusitis, the first tier of treatment for someone you know you've had sinusitis is you should be using saline nasal flushes at least twice a day. And especially if you're using nasal steroid sprays, you should be flushing your nose before you use the steroid spray. And then generally, we put people on saline with a steroid spray and an antihistamine. So you should be doing those 3 things basically every day. And then after that, if your symptoms aren't controlled, then we think about doing allergy testing or the other medical options I mentioned. Yeah.
I had a question. You did not talk about natural alternatives such as honey, natural honey from...
With regards to allergy?
Yes, allergies. Like I find that it helps me with some of the effects of allergies, the throat congestion and the nose as well a little bit.
Well, that is, first of all, there hasn't been any huge randomized clinical trials regarding honey, but that being said, the theory is sound because it's the same as immunotherapy, giving yourself small amounts of the thing that you're allergic to, eventually building a tolerance to that and not mounting such a huge inflammatory response to the thing that you're irritated to. The issue is that you have to know that you're allergic to that bee pollen because that honey is only from that one type of pollen. So if you're allergic to molds and you're taking honey, it really isn't going to help you with the molds. I think it is a great option for someone who knows that they're allergic to pollens and they find that. I can't just generically recommend it to everybody because if you're not allergic to pollen, it's not going to help you. Yeah, but I think it's a great thing if it helps you.
And it's something that I've noticed that as I've aged, it's got a little worse.
Yeah.
And this is the first year I've had to take antibiotics once.
Yeah.
So it's interesting. All the things that you mentioned are the things that I've been through.
Yeah.
But saline is the first thing I'm looking at, and I just do it maybe once or twice a week.
Yeah, you should do it once or twice a day. I think it's great. It's like brushing your teeth with the same principle. So. And it really doesn't harm you to do it twice a day, but yeah. Mm-hmm. Good luck.
Do the nasal saline flushes cover all of the sinus cavities or just a few?
Well, they can if done properly. And so that's why we try to promote the systems that involve more volume, because simply just getting the little bottle of ocean going squirt, squirt, that's not going to wash your sinus cavities. But if you properly bend over the bottle and you gently and use the adequate volume in a good sinus rinse kit, whether it be the neti pot or the sinus bottle, and you gently squeeze it up, you will wash out your maxillary ethmoid sphenoid and maxillary sinuses, your frontal sinuses. You have to be doing it properly. And they, especially the NeilMed kit, I mention that a lot just because it's the one that is found at nearly any store. But there are a lot of great kits out there, and all of them will recommend bending over the bottle or sitting over the bottle or doing something so that it angles it properly to get to all of the sinuses. Yeah, absolutely. Thank you.
Any question over here?
Yeah.
What's post-nasal drip? How is it caused? What causes it? And how to treat it?
Well, postnasal drip is just a generic term for people who have mucus flowing from their nose to the back of their throat. There's many causes for postnasal drip. Some of them include viral infections, bacterial infections, allergies. it can be just due to having you can have a tumor and there's a lot of different causes, but most commonly it's allergies. Most commonly it's cold, and it can be it's one of the major signs of a sinus infection. So it's hard to say. It depends on how long you've had it, if you have it on both sides, what kind of drip you're having. Sometimes it's not mucus, it's your blood from your bloody nose. So it's a generic term for something dripping from your nose to the back of your throat. And that is something you should get checked out. Most of the time, if you just wash your nose out, if you're having allergic postnasal drip or even viral postnasal drip, if you wash your nose twice a day or start using a nasal steroid spray, it can curb that. It can stop that. But it's hard for me to say. It just depends what the cause of your postnasal drip. It's just symptom. It's not a diagnosis. Yeah. Yeah.
My experience with the Neil Med sinus rinse is it does not decongest me.
No, it's not going to.
I will be congested from October till Easter.
Yeah, it's not going to.
And I always have to get out the bad stuff.
Yeah, it just washes the mucus out.
But then I'm plugged worse than when I start.
Yeah, so it sounds like if you're having it from October to April, 6 months, you said? So you have to figure out, are you allergic to something? Do you have...
I'm allergic to fog, too. That's why I like living here. We don't have any valleys.
Or if you have sinus disease, because you might need to not only wash your nose, but you might need to use steroid spray. You should also be evaluated to see if your turbinates are large, which are parts of the sidewalls of your nose, or if your septum is deviated. Some people have S-shaped or C-shaped septal deviations that causes obstructions in both sides of the nose. So it's something that you might need more than just a saline spray.
I have a question for you on the difference of the sinus and the allergies. I mean, they can be so confusing.
It can be
so
very confusing.
Because I have both. So I'm just questioning, do I have allergies or do I have sinus?
Well, they often go together because people who have allergies are provoked and their body is overreacting and they're consistently inflamed. But if you don't have the facial pain, the congestion, the postnasal drip, those kind of things, you might just have allergies. And people who have allergies are predisposed to getting more sinus infections. So that's why people who have chronic sinusitis, it's very important that we treat their allergies. It's one of the basic things we do. We give everyone with chronic sinus infections antihistamines. And if you're still not getting relief, we consider allergy testing. It is a hard thing to discern. But people who have more of the itchy, runny symptoms, they tend to have more allergies. If you're having itchy, runny, and congested, thick mucus, postnasal drip symptoms, you might have both. It's highly possible that you have both.
Okay, we have a question here.
I noticed when I use the sinus rinse that it has trouble draining. And that it doesn't come out unless I'm like bending over or something.
Yeah, that's why it's highly recommended that you do the whole thing bent over the bottle. That's part of it. Because if you just wash and you walk on your day, the next time you bend over to tie your shoes, all this water can come out. It's absolutely true.
How long do you bend over?
Well, you just wait till it comes out. And that's why we encourage people to take time with it and to do it at slow pressure but high volume. So you don't need to shoot it all up there all at once and then expect it to all flow down. Just gently squeeze and wash and let it wash out. Then do your next squeeze and gently wash out. I've been there. I use it. And so I understand, because it's kind of tedious to sit there and gently wait and wash. But it is something you can do when you brush your teeth or if you're in the shower already or,
Over here.
In this neti pot, you use that salt, but can you use the ordinary?
They don't recommend. They recommend pickling salt, and I don't know where to buy pickling salt. But if you look on the internet, there's a lot of recommendations on how to make it. Table salt doesn't dissolve as well because it will just sit on the bottom, but you need bigger crystals of salt so that it will dissolve better in the water. You don't necessarily have to buy this kit. It's just that I personally don't know, I newly moved here, I don't know where to buy pickling salt in Fremont. So if you can tell me that, I'm more than happy to give you a recipe.
I asked my ENT specialist, he says as long as the salt doesn't have any preservatives, you can use it.
You can, but I just have, from personal experience, I don't notice that table salt really melts really well into average tap cold water.
And that sometimes the sinuses cause that bad breath.
Yes.
Is there any cure for that?
Well, you have to fix the underlying sinus disease. So, yeah.
And then Astelin is, you can use that every day?
Astelin is an antihistamine spray for the nose. So there are nasal steroid sprays. The brand names are Flonase, Nasacort, Rhinocort. There's all Viramis. There's all kinds, you know, but they all work the same. They're nasal steroid sprays. Astelin is different. It's the same as maybe a Zyrtec or a Claritin, except formulated as a spray to the nose. So it locally decreases your allergy symptoms in the nose. Usually doctors give both a nasal steroid spray and an antihistamine spray. Okay, because some people don't want to take an oral antihistamine, but it is, yeah.
Last question.
Uh-huh.
For CPAP machine, if you want to eliminate that, I believe there's a surgical treatment.
There are multiple surgical treatments for obstructive sleep apnea. So you're referring to obstructive sleep apnea?
Yeah.
That's what we use a continuous positive airway pressure machine for. But that is determined by where your obstruction is when you're sleeping. So that it can be your nose, it can be your palate, your tonsils, your tongue, there's many areas. So that is determined after a thorough evaluation of your anatomy and after consideration of how severe your sleep apnea is. Because surgery is not curative necessarily for very severe cases of sleep apnea, except for a tracheostomy, because that bypasses all of that. And most people don't want a tracheostomy for sleep apnea. But yeah, that's a different talk for a different day. That's a big subject, yeah.
And just FYI, pickling salt is available at all grocery stores.
Excellent, because I don't know, I had no idea. Well, that's good. There's there's easily recipes for pickling salt and saline flushes on the internet, so they're quite available. But thank you all for your time.
Let's thank Dr. Dattaray.